We love our sunshine here in Arizona, but there are risks if we get too many rays. Skin cancer, it is the most common of all cancers, and it accounts for nearly half of all cancers here in the United States. Here to explain prevention and ways to treat skin cancer is Dr. Christine Lin. She's the Chief of Staff at Affiliated Dermatology. Great to have you here. Such an important topic as we are in these triple digits right now. What is skin cancer and how can we prevent it?
Skin cancer is the most common cancer in the United States. More people are diagnosed with skin cancer than all other cancers combined. 1 in 5 Americans will develop skin cancer sometime in their lifetime.
That's a huge statistic, 1 in 5.
Yes.
And how can we prevent it? What do we need to be doing daily?
The major cause of skin cancer is ultraviolet radiation exposure from the sun. Using sun protection is the most important thing. That includes using sunscreen, wearing sun protective clothing, seeking shade, and of course, regular visits to your dermatologist for skin examinations.
Right, and you said we need to do that regularly. Go in and get our whole body scanned to make sure that we don't have any lesions. You all at Affiliated Dermatology, you offer what's called superficial radiation therapy, or SRT. What is that?
Superficial radiation therapy is a non-surgical treatment option for non-melanoma skin cancers, and that includes basal cell carcinoma and squamous cell carcinoma. Superficial radiation therapy works by delivering a calibrated, precise dose to the skin surface. It penetrates only skin deep, so nearby tissue and underlying muscle and bone are not affected.
That's huge for patients.
Absolutely. And the wonderful thing is using superficial radiation therapy, patients can avoid having anesthesia, having any cutting or bleeding or risk of infection. And they can continue to go about their active lifestyle without interruption.
Right, so those are the benefits for people who've had, the alternative to this. There's no downtime in this, it sounds like. You're just treating the actual cancer cells.
That's correct.
That's incredible. All right, so what can a patient expect when they come there to Affiliated Dermatology? What can they expect during a treatment?
So the treatment protocol will depend on the particular skin cancer and the size, but the typical treatment course will involve several treatments a week for several weeks in a row. And over that period of time, the skin cancer cells will be slowly treated and slough off, and the eventual result will be just a very minimal scarring.
Right, which is what we're looking at. So this is a cancer patient who had skin cancer on the hand, and this is the treatment process. Look at the end there. You can't even see it.
That's correct. So yes, so this is a particular, skin cancer was a squamous cell carcinoma on the hand. And on the hand after surgery, we typically expect patients to have to really take it easy so that they don't pop their sutures and cause issues with the surgical site healing. With SRT treatment, this patient was able to continue with all their day-to-day activities and continue to play golf without any interruption. And the end result, as you can see there, is very minimal scarring.
It's huge. And let's look at the leg, another patient also. Look at you can't even see the lesion at all.
That's absolutely right. In this particular case, this particular skin cancer is on the lower extremity of an elderly woman who has poor circulation, which usually means surgery would put them at risk for delayed wound healing and infection. And treating it with SRT, she was able to continue with her activities and treating the skin cancer cells slowly over time to leave with very minimal scarring.
Wow, huge results. Thank you so much, Dr. Lin. Let's give you some information. Affiliated Dermatology is offering 15% off of their sunscreens. To book your full body skin exam, call Affiliated Dermatology at 602-775-5025 or request an appointment online at affderm.com.